Do you know the difference? Your knowledge could save a life. A person suddenly feels an intense, squeezing pressure in the center of their chest. Which condition is this most characteristic of? Correct answer can be both. If someone suddenly experiences numbness or weakness in their face, arm, or leg, especially on one side of the body, what should you suspect? Correct answer, stroke. A person suddenly begins to have trouble speaking and their words are slurred. This is a primary warning sign of what condition? Correct answer, stroke. Pain or discomfort that spreads to one or both arms, the back, neck, jaw, or stomach is a common sign of what? Correct answer, heart attack. Someone complains of a sudden severe headache, sometimes described as the worst headache of my life. What is this strongly associated with? Correct answer, stroke. You ask someone to smile and notice that one side of their face droops. This is a key part of the FAST acronym for identifying what? Correct answer, stroke. A patient complains of feeling nauseous, lightheaded, and breaking out in a cold sweat. These symptoms are often associated with what condition? Correct answer, heart attack. If a person suddenly has trouble seeing in one or both eyes or experiences blurred or double vision, what is the likely cause? Correct answer, stroke. An individual suddenly becomes confused or has trouble understanding simple statements. This is a major warning sign for what? Correct answer, stroke. Feeling suddenly dizzy or short of breath can be a symptom of which of these conditions? Correct answer can be both. A woman complains of an aching pain in her jaw and upper back without any obvious chest pain. What should be considered a possibility? Correct answer, heart attack. Someone suddenly stumbles, loses their balance, or has trouble with coordination. What medical emergency does this point towards? Correct answer, stroke. Unusual or extreme fatigue that comes on suddenly can be a subtle sign of what condition, especially in women? Correct answer, heart attack. When you ask a person to raise both arms, one arm drifts downward. This test is used to check for what condition? Correct answer, stroke. Sudden fainting or loss of consciousness can be a frightening symptom. Which of these serious conditions could be the cause? Correct answer can be both.